Good afternoon, everyone, and welcome to everyone. It's great to see so many in the room, and welcome to everyone who are following this session online. My name is Kristin Aunan, and I'm a research director at CICERO Center for Climate Research in Oslo, and I will be chairing this session we have called Climate Change and Health in Europe, Knowledge Development and Sharing Efforts. Tackling climate change impacts on health requires knowledge and evidence-based, equity-oriented solutions, both for mitigation and for adaptation. In this session, we will present some results from ongoing research projects, and we will discuss how we can share knowledge on climate change and health, and how we can work together to break down the silos that often exist between public health policies and climate change policies. We will have a Q&A session after the talks, and we'll be using Slido. You can see it on the screen now, I think. So please post your questions and comments, and please address which speaker you are addressing with your question. So with this, I would like to introduce the first talk. And this is an introduction to the topic climate change and health. And we are so lucky to have the speaker here, Sir Andrew Haynes. He's a professor in environmental change and public health at London School of Hygiene and Tropical Medicine, where he was also the director for 10 years. He's a nestor in the field of climate and environmental health, and is very active in research and outreach activities, promoting understanding of climate change effects on health. So please, Andy, the floor is yours.
Well, thank you so much, Kristin, for the introduction. And could I have the first slide, please? As Kristin has said, I'm going to give you a very brief kind of overview of some of the issues around climate change and health, touching on a few issues around the impacts of climate change on health, adaptation and mitigation. And I did want to draw your attention to this report, the ESAC report, the European Academy's Science Advisory Council report, that a number of us were involved with a couple of years ago in 2019. And that provides an overview of the issues, many of the topics related to climate change and health in Europe. So it gives you a much more extensive discussion than we can really have today. In the next slide, you can see a summary of the trends in Europe and other parts of the world. And one of the things, the takeaway messages from this slide is that Europe and the Eastern Mediterranean and the Middle East, which of course is a close neighbour of Europe, are experiencing particularly rapid climate change compared with other regions around the world. So, for example, around the Mediterranean, both the northern part of the Mediterranean, south, and of course the eastern part as well, and also the Arctic are showing signs of rapid climate change affecting a whole range of different physical and human systems. In the next slide, we summarize some of the complex interrelationships between climate change and health. I obviously don't have time to go into detail, but I would just point you to the fact that climate change can have an impact on health through multiple different exposure pathways. And the effects are modulated by socioeconomic, demographic, and other factors. We can divide these impacts broadly into direct effects, like heat, for example, or floods and droughts. Those effects are mediated through natural systems, like changes in the distribution of vector-borne diseases or food and water-related diseases. And those that are mediated through socioeconomic systems, such as increasing poverty, perhaps conflict, population displacement, and migration. And each of these will have implications for Europe and for its near neighbours. In the next slide, I'll just give one example of a major event in Europe. It's the 2003 heat wave, the extraordinary heat wave that caused probably around 70,000 excess deaths in Europe, something of that order. Different estimates vary slightly. And we now know that human-induced climate change really amplified the effects of this extreme heat wave. Perhaps 70% of the heat-related deaths in central Paris, for example, would have been most unlikely to have occurred in the absence of human-induced climate change. And these temperatures, the extreme temperatures, will of course become the norm in decades to come. So that was an early signal that human-induced climate change is having a big effect on health. And I think Antonio will talk about some more up-to-date information, evidence on that in just a moment. In the next slide, just draw your attention to another finding which has become much more prominent in the last couple of years, and that's wildfires, wildfire risks. It's now very clear from a major review that wildfire risks do increase as a result of climate change, and we know that wildfire smoke differs in a number of ways from the particulate matter from urban sources. It has a lot of fine particles. They're very damaging. They contain more oxidative components. And Antonio and his colleagues and others have shown in a series of papers in Lancet Planetary Health how these are having an effect on human health. They increase death rates, for example, in the days following exposure to wildfire smoke. And the smoke can drift for very large distances. So burning of the Amazon, for example, affects health as far south as Sao Paulo in Brazil. And in the next slide, I'm just concluding really by saying that, of course, we can't stop at just describing the impacts of climate change on health. We have to provide evidence for effective action. And as we already heard, those actions can be divided into two broad categories: mitigation, which improves the prospects for health by reducing, for example, the fossil fuel-related air pollutants, or promoting progress towards sustainable diets that are much lower environmental impact and healthier, and also sustainable cities. And adaptation, which helps to manage those and reduce those health effects that we can't prevent through mitigation. This can include things like early warning systems, heat-related early warning systems, disease early warning systems, more resilient supply chains for health systems, and also reaching out to other sectors to ensure that the built environment is also more resilient to floods and droughts, for example. So increasingly, we need to integrate these strategies, mitigation and adaptation. They tend to work in silos. Often the people involved in the two activities don't work closely together. And increasingly, we need to ensure that they are closely integrated to avoid unintended adverse consequences and to build on the synergies between these two types of actions. So I'll stop there and hand over to the next speaker. There's a lot more I could say, but I'll stop there.
Thanks a lot, Andy. In the next two talks, we will get to know some of the results from an ongoing research project. It's a EU Horizon 2020 project called Exhaustion. So if you can put the slides on. Thank you. So the Exhaustion project is a 4-year research and innovation project for the Horizon 2020 project. Next slide, please. We have 14 partners in 10 different countries all across Europe. Next slide, please. So climate change is affecting human health in many ways through a multitude of pathways. The Exhaustion project addresses two important pathways related to key climate risks for Europe and beyond. And the first of these are the direct effects on death and disease from increasing temperatures. The second is the impact that global warming has on air pollution, including from wildfires, as Andy just mentioned. Next, no, not next. So, hot temperatures, they do not affect everyone equally. If you are working in an air-conditioned office, your exposure to heat stress is very different from doing manual work outdoors, for instance, on a construction site. And we also know that living in the middle of a city, you are exposed to much higher temperatures than outside in the green areas where there's lots of trees and parks and rivers, etc. This is due to what is called the urban heat island effect. So an important part of Exhaustion project is to address the question of which population groups are exposed to higher levels of heat stress and air pollution. And then it is the fact that in addition to heat exposure in itself, there are a range of factors that can affect the health outcomes of this given exposure. And we know that vulnerable groups include small children, older adults, and people with various comorbidities. That could be, for instance, people with cardiopulmonary diseases, which is particularly targeted by the exhaustion project. And we know that Europe's population is aging, and that means that we are getting a larger fraction of frail and vulnerable people when it comes to the effects of environmental stressors. So, next please. In exhaustion project, we use different approaches to estimate the economic costs of projected health effects. That is related to the direct cost of hospitalization, for instance, to the broader socioeconomic consequences of death and disease, and also the impacts on worker productivity, which we will learn more about in a minute. So through establishing the impact pathway from the climate change to changes in exposure and health damage in Europe, the ultimate objective of the exhaustion project is to answer the question, how can we reduce exposure? How can we reduce individual risks? And what are the costs of adaptation measures? And what are the benefits of mitigation? So now, as I said, we will hear from two speakers. The first one is Antonio Gasparini from the London School of Hygiene and Tropical Medicine, and he will talk about increase in heat-related deaths due to climate change in the last 30 years. Antonio Gasparini, he's a professor of biostatistics and epidemiology at London School of Hygiene and Tropical Medicine, and he's a core scientist in the exhaustion team. So please, Antonio, the floor is yours.
Okay, thanks, Christine. Thanks to you and to the organizers. Very happy to be here, and thanks to everybody attending this event. Today we'll provide an example of one of the studies we have contributed with to know more about climate change. And this one in particular was led by our team at the London School of Hygiene and Tropical Medicine, together with Anna Visato-Caberni, her team at the University of Bern. Next slide, please. So one of the main issues with all the research we have done on climate change is that we always looked at the future. So on the right, there's an example of one study that we published in 2017, in which we provided estimates of an increase in heat-related deaths in red and the decrease in cold-related deaths in blue under different scenarios of climate change within this century. The problem is we always look at this problem as a problem of the future in a way that we are not experiencing now. So we decided to take a different perspective. And next slide, please. We took data from the same big collaborations that we are coordinating from the London School of Hygiene and Tropical Medicine. It is called this multi-country, multi-city collaborative research network. Through it, we were able to gather data from many different places around the world, including both high income and low and middle income countries. Of course, there are big gaps in these maps, but we were able to tell a story about different places. And next slide, please. From all these places, we were able to apply rather sophisticated epidemiological model to measure the so-called exposure responses between temperature and mortality, basically explaining how the risk changes depending on which temperature you are exposed to. And all these curves, they are showing basically how your risk increases if compared to a minimum optimal temperature when you are experiencing, in particular, hotter temperature during the summer. Of course, these risks change across places because of the underlying vulnerability of the different populations. And so we're able to characterize the risks all around the world. Next slide, please. In addition to that, we took data from global climate models to derive two scenarios. One scenario, and it is the darker line there, in a way it's a representation of the factual trends of temperature that we have experienced from the beginning of the last century. And this, of course, shows the infamous, if you want, hockey stick shape with a big decrease starting from the 70s in the temperature throughout the world. But the other scenario probably is newer, and it's a so-called counterfactor scenario in which we measure what this trend would have been without the anthropogenic contributions. And therefore, by comparing these two, you can have a measure in the past period, in the past 30 years, about what is the different temperature we have experienced throughout the world. Next slide, please. Now, this was an average across the whole world, but of course, places, they have warmed in to a different degree in the past 30 years, and therefore there are places just like Southeast Asia and some places in South Europe showing a big warming if compared to 30 years ago due to anthropogenic emissions, other places much less. Combining these two information, the risk and the increase in temperature, next slide, we were able to derive a measure of impact, meaning the excess mortality from a baseline of heat-related deaths under the two scenarios. And the two scenarios show something different, in particular 0.98 increase in mortality in the counterfactor scenario, this milder, in a way, climate because of the lack of anthropogenic emission, while what we have experienced is the 1.56% increase, and this difference tells the story about how much of the current, in a way, the historical increase in heat-related mortality we have experienced because of anthropogenic emissions. Now, next slide and final slide, we want also to report this in a different way, meaning what is the percentage of the whole heat-related deaths in the whole world that could be attributed already to climate change. And we were quite surprised to find such a big figure of 37%, of course, changing, as you can see, in different places, but all of them with a significant proportion of that attributed to anthropogenic emissions, and in a way, 1 out of 3 of heat-related deaths that can be already attributed to climate change and climate change due to anthropogenic emissions. So the message is very clear. Climate change is not something that we will experience in the future in terms of health risks, but we are already in a world in which we are experiencing significant risks. Thank you very much.
Thanks a lot, Antonio. I know that you have to leave before the Q&A session, but I'm sure that if anyone has questions for Antonio, you can reach out to him through...
Thank you very much.
Okay, so thanks, and we move on to the next. Here we see the Slido, in case you have questions. If you have questions for Antonio, I think you have to be quick. Anyone in the room who has questions for Antonio, perhaps? No. Okay, so I think we have to move on. We have a lot on the program here. The next one is about economic costs of heat-induced reduction in outdoor worker productivity due to global warming. And the speaker is my colleague, Anton Orlov. He holds a PhD and works as a senior research fellow at CISRO. And Antonio is not here, so we will show a pre-recorded video.
My name is Anton Orlov. I'm a senior researcher at CISRO. Here, I would like to present some main results from our economic analysis on heat-related impacts. Apart from direct health impacts, heat stress could also affect work capacity and productivity. In one study, we assessed global cost of future heat stress impacts on worker productivity using an interdisciplinary approach, which combines climate projections, epidemiological, and economic analysis. We conducted our study for 2 mitigation scenarios. One is a low emission scenario, RCP 2.6, and a high emission scenario, RCP 8.5. We found that future heat stress impacts could result in a substantial reduction in worker productivity, especially low latitude regions such as African and Asian countries are at a high risk of exposure to heat stress. Even under a low emission scenario, RCP 2.6, heat stress could lead to a reduction of 0.5% in global GDP. Under a high emission scenario, RCP 8.5, the global cost could reach a 3% reduction in global GDP. Compared to the global economic responses, regional economic losses are substantially more pronounced in the most vulnerable low-latitude regions. In another study, we focus on the agricultural sector, which is exposed to heat stress because agriculture is a low labor-intensive sector and requires working outdoors. In this study, we combine and compare the direct impacts on climate change and crop productivity with heat stress impacts on worker productivity. The climate-induced impacts on crop yields were derived using the outputs from crop model simulation, and the heat stress impacts on workers were quantified using exposure response function and output from different climate models. We found that under high emission scenarios, global crop productivity could increase due to the so-called CO2 fertilization effect, which implies an increased rate of photosynthesis, leading to a higher crop yields. However, the cost of heat stress on labor could offset the potential economic benefit of elevated CO2, especially in poor countries where agriculture is less mechanized. For example, we found that the cost of crop production could increase up to 10 percentage points in the vulnerable tropical region, such as South Asia, Southeast Asia, and Africa. In another case study, we focus on Europe. We quantified the cost of heat-induced reduction in outdoor worker productivity due to the heat waves which occur in Europe in 2003, 2010, 2015. In this study, we focus on two sectors, which are agriculture and construction. Our analysis was based on the reanalysis data from ERA 5. We quantify both direct and indirect costs. Indirect costs result from sectoral interdependencies, meaning the production of goods and services rely on inputs from other sectors, so heat-induced reduction in productivity could propagate through the supply network chain. While the macroeconomic costs are found to be small, because agriculture and construction contribute to a small share in European regional economies, the sectoral costs could be non-negligible, because the frequency and duration of such heat waves are expected to increase in the future. For example, we found that on average, the direct cost of reduced worker productivity in agriculture due to the past heat waves could be between $59–90 per worker per month. For the construction sector, it was between $41 and $72. What we also found that the social cost, which include both direct and indirect costs, is 47% higher than the calculated direct economic cost. To summarize, the future cost of heat stress impacts on work capacity and productivity could be substantial, especially in the most vulnerable low-latitude regions under high warming scenarios. But even in Europe, the sectoral heat-induced cost might be non-negligible. More proactive mitigation policy and adaptation measures to heat stress, such as mechanization and air conditioning, are needed to reduce the adverse heat stress impacts on health and economic productivity. We also found that a large part of mitigation costs could be offset by avoiding the cost of heat stress. Thank you very much for your attention. Please feel free to contact me if you have any questions.
So thanks a lot to Anton Orlov. As I said, unfortunately, he's not available, neither in the room or online. But as he says, please feel free to contact him if you have questions about his very exciting work, very important work on the worker productivity loss. So let's move to the next speaker. The topic is presentation of the new European Climate and Health Observatory, closing the knowledge gap on climate and health. And the speaker is Alexandra Kazmierczak. Alexandra is the coordinator of the European Climate and Health Observatory at the European Environmental Agency. Before taking her current role, Alexandra worked on urban adaptation to climate change and environmental inequality. She has a background in geography and environmental sciences. Alexandra, please, the floor is yours.
Thank you very much, Christine, for the introduction. I must say it's been an absolute pleasure to have been organizing these events with such a wide range of so many knowledgeable colleagues working on climate change and health. I really regret not being able to be physically present in Glasgow. In my presentation, I would like to indeed give a brief introduction to the European Climate and Health Observatory, starting from introducing the European Environment Agency. We are an independent EU agency, and our job is to provide a robust and independent environmental information to policymakers at all governance levels, as well as broader public in Europe. So we very much work with collecting and analyzing the information from the member and collaborating countries, but we also work with scientists, such as those who have been just speaking, in order to better present this knowledge, just in a language that would be accessible to policymakers. Next slide, please. So the European Climate and Health Observatory emerged because of the recognition of the persisting knowledge on climate change and health. Despite the research efforts, there is still a gap, and this gap has been recognized in the new European strategy on climate change adaptation, which emphasizes that we need a better and deeper understanding of climate change impacts on health and a greater capacity to address them. And that's how the European Climate and Health Observatory was born. Next slide, please. It was launched in March this year with an aim to really better understand, anticipate, and minimize the health threats caused by climate change. In its physical presence, it's a portal that aims to provide a knowledge base for policymakers, to provide tools and access to relevant information, and to pool the resources from various organizations in order to really foster the information exchange, cooperation, and learning from each other. In the next slide, I would like to present the partnership of the observatory. It's being led by the European Commission, and the really key thing is that we have the representatives of DG Climate Action as well as DG Public Health and Food Safety, which shows the commitment of the European Commission to work across the silos that were mentioned in the introduction to the session, and really to pull together a variety of organizations working on climate change, on health, or on both, to contribute their respective knowledge to the observatory. So apart from the European Environment Agency, we have a couple of other agencies, WHO Europe and Lancet Countdown, as well as Copernicus. So with those partners, we've been working together to generate knowledge. So with the Lancet Countdown, we published a report earlier this year that is trying to draw attention to the key climate risks to human health, as well as the existing policy landscape and how we can prevent those. What it really emphasizes is and what's been mentioned by previous speakers, is the growing vulnerability of the European population to heat stress through increasing urbanization, through the aging population, prevalence of diseases. Next slide, please. What we also try to do is bring the climate information and data closer to the policymakers by presenting the Copernicus Climate Service outputs at the national and regional level, showing how, for example, the number of health-related heatwave days is likely to develop across the century, guiding the decisions that need to be taken to prevent the excessive loss. Whilst heat is a very big factor in mortality and morbidity. Next slide, please. We also focus on raising awareness of emerging risks, such as, for example, the increasing climatic suitability for various vectors across Europe, such as the tiger mosquito, which is a carrier of diseases such as dengue, Zika, or chikungunya, for example, and how the situation is likely to develop across the century. Next slide, please. We also try to facilitate access to the tools and resources produced by our various partners by embedding them in the website, by collecting them in the resource catalog. We also reach out to various research projects, such as MBEL, for example, and try to collect the information and present it in one place to make the observatory really the sort of key resource for climate change and health for Europe. And in my last slide, you can just see the last slide, please. You can just see the web address of the observatory as well as the email. So if you have any questions or comments or suggestions, as well as if you would like to provide any material for the observatory, please feel free to get in touch with us. Thank you very much.
Thanks a lot, Alexandra. Very interesting and important work that the observatory is doing. We move on to the next speaker, who will talk about tackling the challenges of climate change for health in the Mediterranean, Science Policy Frontiers. And the speaker is Nina Hobban. Nina holds a PhD in plant reproductive ecology. She is a scientific policy officer in the European Academy's Science Advisory Council for the SAPEA, the Science Advice for Policy by European Academies Consortium, which is an integral part of the European Commission's Science Advice Mechanism. And she manages a broad range of science for policy projects, among them some on climate change and health. So please, Nina, the floor is yours.
Thanks, Miriam. I'm going to introduce 3 initiatives from the Science Policy Frontier that bring scientific knowledge to tackling the challenges of climate change for health in the Mediterranean. Next slide, please. Andy Haynes has already introduced, next slide, please. Andy Haynes has already introduced the ESAC report that was based on a working group project for 2 years. And I'm just going to quickly introduce ESAC. Next slide, please. ESAC is the European Academy Science Advisory Council, a network of national science academies of the EU, including Norway, Switzerland, and the UK, with a mission of providing independent, expert, and evidence-based science advice to European policymakers. So this publicly available report contains evidence-based recommendations for policymakers, emphasizes the health co-benefits of climate change mitigation measures, and draws attention to the need for health in all policies aimed at climate change adaptation and mitigation. Since the publication of this report, ESAC has engaged with policymakers in EU institutions, UN regional offices, and member states. Notably, it was a key source of information for the group of chief scientific advisors' scientific opinion on climate change and health. Next slide, please. The ESAC project also spurred a global project on climate change and health by the Inter-Academy Partnership. This is a global network of over 140 science academies with 4 regional networks in Europe, Africa, Asia, and the Americas. And this 3-year project explores climate change adaptation and mitigation strategies that bring health benefits. The outcomes are firstly 3 regional reports for Africa, Asia, and the Americas, which will provide a snapshot of the current situation and present science-based recommendations for each region. And here the evidence gathering process is already drawing to a close, so these reports will come out soon. And in addition, there will be, next slide please, a global synthesis report that highlights the regional similarities and differences and provides advice for decision makers for the implementation at global, regional, and national levels, taking into account local circumstances and strategic needs. Next slide, please. And this report, yes, will come out in the first quarter of 2022. Next slide, please. In addition, I would like to draw your attention to the Eastern Mediterranean and Middle Eastern Climate Change Initiative, or in short, MACCI, which was kicked off by the government of Cyprus in March 2019. This is a very ambitious initiative aimed at coordinating a concerted effort by the countries of this region to adhere to the stipulations of the Paris Agreement and to address and ameliorate the effects of climate change in the region. Next slide, please. Here you can see that this initiative is very broadly set up. It has 13 task forces that look at different aspects by which climate change will affect humanity. One of them is a task force on health, to which ESAC has also contributed. Next slide, please. And this policy advisory report resulting from the collaboration of these task forces will come out before the end of the year. Next slide, please. ESAC, IAP, and the Cyprus Institute, which coordinates the Cyprus Climate Change Initiative, have collaborated in producing a joint workshop in May 2021 to assess the scientific evidence base for this somewhat elusive and underrepresented region, to evaluate options for protecting and promoting human health in the face of climate change, and to inform policy initiatives by the Cyprus government, ESAC, and IAP. And you can see here that the 16 countries from the EMI region, as well as Mediterranean adjacent countries, were selected to really bring in a very broad and complementary perspective on climate change and health in this very large and very diverse region. This report is publicly available under the link given here. Next slide, please. I want to just run you through the key conclusions and recommendations of this initiative. Despite the region's diversity, common challenges are health threats posed by climate change, the need to develop resilience and equitable health systems, and to address fragmentation of research systems. At the same time, it is important to be aware that scientific advances worldwide are available to develop solutions adapted to local contents. It's important to develop collaborations between scientific disciplines and countries in research and data collection, to share infrastructure, skills, and methodologies, and to jointly build trust in responsible science. The scientific community must also collaborate in advising on how to use the knowledge that is already available as a resource for innovation, to guide practice, and to inform policy options. Another conclusion is that it is very important to integrate the use of scientific evidence for policy across sectors. Health issues are relevant to the formulation of policy in many sectors beyond the formal responsibility of health sector policymakers. The coordination of efforts is essential to understand trade-offs and inadvertent consequences, and to capture synergies for diverse policy actions. And of course, policy decisions must take into account the societal attitudes towards risk and other social values. And here I want to emphasize the value and the important role of national academies of sciences in helping policymakers understand diversity, so that the regional emphasis in policy can be science-based as well as economically and socially feasible. I conclude by emphasizing the specific relevance of these initiatives by ESAC, IAP, and the MACCI, and the messages that result from these initiatives on protecting human health from the effects of climate change and health. These messages are important to those EU member states that are located in the Mediterranean, for the priorities of the EU neighborhood policies, and for other domestic policy options that must take account of climate change impacts in this neighboring region, for example, in terms of food and energy imports, air pollution, and forced migration. Again, national academies of sciences, the networks of academies, and regional initiatives such as the Cyprus Climate Change Initiative are very valuable sources of scientific advice for policymakers. And one cannot overemphasize the importance of international collaboration in providing scientific advice to policymakers to promote the development of policies that account for and plan for the transboundary nature of global threats such as climate change. Thank you.
Thanks a lot, Nina, for your talk. Now we have come to the last talk in this session. The title is Climate, Health and Gender, Breaking the Silos for Planetary Health. And the speaker is Dr. Nicole de Paula. She holds a PhD in International Relations and is affiliate scholar at the Institute for Advanced Sustainability Studies in Potsdam. She is the founder and executive director of the Women Leaders for Planetary Health and is the scientific commissioner on the Lancet Pathfinder Initiative. So, Paula, please, the floor is yours.
Hello to all of you. Thank you to the EU Pavilion for the opportunity to present our work here at COP26. I'm speaking from Berlin today, but I'll be in Glasgow very soon, and we can connect personally there too. So we have heard really important contributions about the synergies between climate and health with a greater focus in Europe. I'm now inviting you to expand your horizons a little bit. In my brief talk, I will emphasize the necessity to frame health and climate debate under this broader umbrella that we call planetary health. And besides the scope of this conversation, I will also highlight the importance of reducing inequalities for transformative action in the area of sustainability and health. You can move to the next slide, please. So, for around 5 years, I have been enthusiastically working with the Planetary Health Alliance, and it's an alliance based at Harvard, but it's really a global effort with more than 250 member institutions from more than 40 countries. And together we want to share the simple message that our health depends on a healthy environment. And if we take a look at these numbers here in the slide, we realize that much of the progress, including in public health, has been occurring at the expense of the most precious resource that sustain our lives and promote well-being. And it's particularly impressive, for example, that we use around half of the planet's surface to feed ourselves. So science has been alerting us about the dangers of depleting our planet, which is really our only home. We heard a lot about climate change. But if we move to the next slide, one of the biggest challenges that we have, despite the urgent scientific alerts that we heard so well today, we are not acting as fast as needed. And I think really brings this dimension of cooperation that we talked at the introduction. So the example of emissions is the most emblematic. The International Energy Agency has recently released this report showing that CO2 emissions from energy and industry have increased by 60% since the Climate Convention was signed in 1992. So we really have to, we are all connected here at the COP, but it seems that we're not doing our homework fast enough. Next slide, please. So as I said, these alerts go well beyond the climate sphere, and we have strong evidence that we're crossing several planetary boundaries. And climate change is particularly pushing these tipping points in our Earth system. Tipping points are really a moment in which ecosystems can no longer cope with the environmental change and then risk to suffer irreversible change. From collapsing ice sheets, we have thawing permafrost, shifting monsoons, forest diebacks. Really, the man-made impact on our environment is representing an existential threat. And I heard this say the name of that game. It's a little bit like this Jenga game, apparently it's in English. When we are at this gradual increase in global temperature, sees this block after block removed from the tower, placed at the top, right? And times goes on, the tower becomes more and more unstable. And at some point it will collapse. And in this game of Jenga, this collapse is a very, very fast one, right? It is split in a second. So we seem to be playing this game with our planet. Next slide, please. And although it seems an obvious conclusion, the health sector has been underrepresented in the climate negotiations. So if there's one positive thing coming out of this pandemic is that one of the biggest reasons for changing that, and we are seeing also an example of this event now bringing the climate and health community in a much stronger way. That's one positive thing, because indeed we need more cooperation in these areas. And there are so many interrelated areas where drastic environmental change is impacting our health. My colleagues provided details about heat waves, respiratory diseases, but we can see a longer list here. And of course, the negative impacts of of all of these transformations, we see more strongly in developed countries. I am from Brazil. So of course, indeed, as Andy Haynes, you mentioned, what is happening in the Amazon, we are feeling in São Paulo. There were awful images on the internet, this black dust coming, and we are seeing these disconnections more and more. So globally, we see natural disasters and variable rainfall patterns illustrate this challenges then very well. Globally, the number of reported weather-related natural disasters has more than tripled since the 60s. Every year, these disasters result in 60,000 deaths, and again, mainly in developing countries. But not only, I am speaking from Germany when we saw on the media very recently, more than almost 200 people dying of floods here, cities in Germany, despite all the knowledge that they had. So it's clear that more needs to be done to unite us, science and implementation. So rising sea levels will resulting, of course, material damage, as we saw. We see these events in Germany, but in São Paulo, it's unfortunately a reality that every month of January, big cities like São Paulo with almost 20 million inhabitants are suffering from this damaging floods. And more than half of the world's population lives within 60 kilometers of the sea. So people may be forced to move, which in turn increases the risk of range of health effects from mental disorders as well to communicable diseases. So, of course, these rising temperatures and variable precipitation are likely to decrease the production of staple foods in many of the poorest regions. And we saw some details with my previous colleagues speaking. Next slide, please. And so it's clear that the public health in the Anthropocene deserves serious rethinking, and planetary health is thus a valuable narrative to communicate this interconnected challenge. So I'm very honored to be here with Professor Andy Haynes, who chaired the Rockefeller Lancet Commission launched in 2015, which gave this new force for the planetary health work, not only as a scientific field, but also as a social movement, which is a dimension that sometimes we tend to forget. How do we drive transformation? It really needs to be connected to the social parts. Next slide, please. So I don't know how many times, but we hear a lot about silos. So I'm a political scientist, I'm in international affairs, and I got motivated to write this book, Breaking the Silos for Planetary Health. It will be launched next week. But we need to move from words to action, and we need more cooperation and extra focus on implementation. We know that COP26, the word ambition, is our main goal here. So we know that our institutions and communities, unfortunately, remain fragmented. But I'm excited to share in a specific effort that as a community we launched, and that's why I would like to invite you on the next slide to take a look. So it is my pleasure to share this information about the São Paulo Declaration on Planetary Health, a recent global effort to unite voices from 19 stakeholder groups, calling for specific action that can protect both people and the planet. So again, as I repeat this, we need to go much beyond only the climate community. And it was supported by the UNDP. This declaration results from a large consultation process, over 300 people from more than 70 countries participate in this event. So this work really testifies this urgency to connect the dots between environmental and health agendas. Next slide, please. Here, you can see some prominent institutions who are part of this movement. I would also invite you to look this in our website. A video is also available for those who would like to learn more, to participate. And what is interesting about this movement, after this declaration, we seem to be advancing what I call also new insights for the planetary health diplomacy. The United Nations Development Program is now also leading a new consultation process on how to make planetary health a core work area in its program, because it's becoming clear that the new paradigm in development needs to be developed. Next slide, please. So just in conclusion here, I'm also the founder of the Women Leaders for Planetary Health, which also we bring this dimension of gender that we mentioned. And we know that the COP26, to be successful, we really need to take global inequalities seriously. And I would invite you all also to check a global campaign that we are supporting called She Changed Climate. And this is started after we have noticed that even in a country where, like the UK, gender equality at the COP26 presidency team was basically non-existent. So diverse leadership is essential to move towards a healthy recovery and, of course, to advance implementation of all these policies and knowledge that we have on climate change and health. Thank you very much. I'm looking forward to our discussion.
Thanks a lot, Nicole, for this important work and important words. We have now come to the last part of this event, which is a Q&A session. So I hope that we will get some engagement in the room and on the Slido. Are there I will leave, my colleague Miriam Dahl will lead the Q&A.
Yeah, thank you so much to all the speakers. Now we will, I'm Miriam Dahl from Cicero Center for International Climate Research. And now we would like to open the floor for questions from the audience. You need to use the Slido to pose your questions, also for those in the room. Please, do we have Slido on the screen? Please scan the code or enter Slido with the code and pose your question. We will start with the question that you see on the screen. What are the co-benefits of acting on climate change and health in other policies? And which other policy fields could have the biggest co-benefits for health? Andy, do you want to start with this question?
Sure. Thanks very much for this question. Well, co-benefits, first of all, we need to clarify what they are. Co-benefits are defined as ancillary benefits. So they're benefits that accrue as a side effect, if you like, of a, say, in this case, a climate change mitigation policy. And the big benefits to health are the benefits of moving, for example, towards clean, renewable energy, away from coal and other fossil fuels, means that we get a big reduction in air pollution, particularly fine particulate air pollution, but also other sources of air pollution as well, like nitrogen dioxide. And these, of course, will have very large implications, beneficial implications for our health. So one estimate suggests, for example, perhaps 3.6 million deaths a year, premature deaths a year, as a result of the air pollution from burning fossil fuels. So when we stop burning fossil fuels, obviously we benefit from the reduction in those deaths. And those benefits can occur really quite quickly. And they're in addition to the benefits, the longer term benefits of reducing dangerous climate change. Another example would be the food system. So the food system, as we know, contributes about 30% of greenhouse gas emissions, including a lot of methane from ruminant animals, from rice paddies and so on. Moving towards more sustainable diets could certainly prevent many millions of premature deaths, according to the Lancet Commission. Perhaps 10 to 11 million premature deaths by the middle of the century, something of that order, from moving toward what they call a planetary health diet, much less consumption of animal products, red meat, more fruit and vegetables, and so on. And then thirdly, redesigning our cities to make them more conducive to active travel, using public transport, walking and cycling rather than dependence on the private car. And that could have beneficial effects, not just from reduced air pollution, but also from increased physical activity, which could amount to several million premature deaths a year averted, something of that order. So those are just some examples. There are other areas we don't know as much about, like nature-based solutions, for example, green space, converting much more sustainable agriculture, agroforestry, and we're actively researching the health benefits of so-called nature-based solutions. So a lot we do know, but still some more to find out.
Thank you, Andrew. And we can put up the Slido again and take the next question. Why is the EU focusing on adaptation within its own borders instead of international action? Alexandra, do you want to take a stab on this?
Yeah, sure. Firstly, I guess that, the issue is then that Europe is very vulnerable to climate change impacts. I was actually astonished to find out from the Lancet Countdown report that Europe is the continent or the world region with the highest vulnerability to heat impacts, looking at the makeup of the population, due to aging and the prevalence of many diseases, as well as to the high level of urbanization. People in Europe are really vulnerable to climate change impacts, mainly through the impacts of heat. So I think that there is a good reason to focus on that. But also, I guess that in the recent EU adaptation strategy, we can see that international action on climate change adaptation is one of the 4 priorities of this adaptation. We want to make the adaptation faster, smarter, and systemic, as well as looking beyond our borders and really investing the efforts and funds into increasing the coping capacity and reducing the vulnerability of other world regions. So if anyone would like to comment on that too.
Anyone else from the speakers who wants to complement Alexandra? Should we move to the next question?
Can I just maybe a quick comment on that? And it's very interesting to perhaps increase the cooperation. When we have the recent study from the Global Climate and Health Alliance on the NDCs, a scorecard that I would invite our speakers to participate. It was interesting to see how also low and middle income countries are perhaps showing the way and taking health into consideration in perhaps in a role model more than developed countries. So it's also an interesting way to show that these countries are also working on the health dimension. And of course, this North-South cooperation could be strengthened. Just an observation. Thank you.
Thank you, Nicole. I think we'll move then to the next question to have a chance to have more questions. So we will take the question, to what extent did the research project integrate the One Health approach, taking into consideration both human as well as veterinary and or plant health? Kristin, you are the leader of several research projects. Do you want to try on this one?
Sure. Speaking for the exhaustion project that I presented here today, and also other projects we have at CICERO. The primary topic is human health. As we have learned today, there are very many topics that we could address when it comes to climate change and health, so we have to be selective. So in our project, we've actually focused on cardiopulmonary health in Europe. So we have different data sets on mortality, daily mortality, and we have cohort data. We have quite detailed information about the populations and how they have responded. We use historical data, how they have responded to changing daily temperatures. So we can derive the dose-response relationship that Antonio talked about. I would also like to mention, however, that in one of the projects, we also actually address agricultural crops. An important part of this project that we are leading at CICERO is not only about heat stress, it's also about the interlinkage and the potential synergies of heat stress and exposure to air pollution. So we have also addressed that in one of the projects. So we look into how the combined impacts of heat stress and air pollution, how that also affects agriculture crop loss. And that is also a very important part that we haven't addressed here, of course. It seems that we have now come to the, maybe we have time for one more question, I think, actually.
I think we can have time for one more question. I think we can have this question. The WHO and health groups have been working since 2009 to get health into the climate debate. And why have we not advanced more? And how can we, after Corona, improve this? I think this is a good question to end with. Andy, do you want to take that?
Yeah, well thanks, Anja, for that very important question. I think there are a number of answers to that. One is, of course, that the amount of resources devoted to climate change and health has been minuscule compared to that devoted to the whole biomedical research endeavour. I guess it's probably about 1,000th or something like that of the resources that have gone into biomedical research. So although we have generated a lot of evidence, it's been quite patchy compared with the sheer volume of evidence around biomedicine. The second is, of course, that health is not just, many people conceptualize health as health care. They equate health with the provision of health care. And of course, in climate change terms, what I think has been clear from these presentations we've just heard is that health is affected through many pathways, and many sectors are involved in adaptation and mitigation strategies. So one of the challenges that we've had is engaging decision makers from these different sectors, rather than narrowly focusing on the healthcare sector. And clearly that needs a different kind of approach, because many of us believe that many decision makers in all sectors are actually health decision makers, and we need to ensure that they understand their responsibilities in that regard. And I suppose the third point I would make is that there's also been a lot of misinformation and disinformation, as we know, about climate change. Not only about the fact that climate change is human related, it's now obviously almost universally accepted that it is related to greenhouse gas emissions from human activities, particularly the ones we've discussed just now. But there's also, I think, been a lot of sort of underplaying of the health effects as well. And now with these powerful new techniques, and Antonio's referred to them briefly, like detection and attribution, we're in a much stronger position to say these deaths are due to human-related climate change. And I think that will be one of the things that kind of transforms the whole dialogue, the whole discourse around climate change and health. And particularly, we're all sensitized now, aren't we, to the effects, because of COVID, the effects of a breakdown in public health on our health, the health of everyone on the planet. So I think we are in a different era now. We need to capitalize on that, and we need to move forward and really scale up our impact to really ensure that the public widely do understand this message that climate change and health are inextricably related. Thank you.
Thanks a lot, Andy. I think these were very nice words to end this session with. And there are many questions we haven't addressed from the Slido and, of course, in the room. And there are many issues we could have talked about for a long time, I suppose. But we had 1 hour. So with this, I just have to say thank you to all of you, to the speakers, and to the audience out there, and to the audience in this room. Thanks a lot.